In healthcare analytics, your biggest choice is the data source, claims or EHR. This choice defines your reality. What if your data is hiding the truth? EHRs can dramatically underestimate the real cost of patient care. This problem goes deeper. An EHR shows a doctor's plan, the treatments and prescriptions they ordered. But claims data shows what truly happened, what was paid for, dispensed, and actually performed. So how do you choose? We'll provide a framework to decide when to use each and when to combine them. Think of claims data as a satellite map of a patient's complete healthcare history across many systems. EHR data is the opposite, a microscope. It gives rich clinical detail from inside a single health system. The initial choice is clear: breadth versus depth. The whole story, or every detail from a single stop. But there's another dimension: time. Claims data has a built-in delay, often months old by the time you see it. EHR data, however, is captured in near real time. It's updated with every patient visit, offering a current view. So, which is better? An older map of the whole system or a live snapshot of one location? It depends on your question. Claims data is broad because its purpose is billing. It answers one question: who gets paid for what? EHR data is deep because its purpose is clinical care. It's a tool for treating the patient right now. That time lag in claims is a feature of adjudication. Services are rendered, reviewed, then paid. This takes time. EHR's real-time function is for patient safety, but its focus on the now creates a massive blind spot. That real-time detailed data is trapped. Hundreds of EHR systems don't speak the same language. How can you see the full picture? Understanding why they differ is foundational. Now let's see how this works in a real-world scenario. Imagine studying a rare disease. You need to find patients. You start with claims data for its massive scale to identify a group. But now you have a problem. Your list of patients is just that, a list. Claims can't tell you illness severity or progression. This is where EHRs are needed. For that group, you get their clinical story. Claims finds the who. EHR explains the why. Neither data set could have finished the study alone. One supplied the scale, the other supplied the substance. But even when used correctly, both data types have hidden traps. What are the blind spots you need to know about? First, claims data only sees the insured. It misses uninsured patients and cash payments, skewing your view. Second, EHR data quality is inconsistent. It is only as good as the clinician's notes. Incomplete notes mean incomplete data. Third, the richest EHR data is unstructured text. Reading it requires advanced NLP and data science skills, making it expensive. And that fragmentation problem? It's called a lack of interoperability. This is the single biggest barrier to a longitudinal EHR view. This fragmentation is exactly why EHRs underestimate costs, as we saw at the start. They can't see the care happening in other systems. We've seen the strengths and weaknesses. The path forward is strategic integration, linking claims and EHR to create one superior data set. This linked data gives you the broad view of claims, filled with the rich clinical detail of EHR. It solves the breadth versus depth problem. This combination opens new insights, like the effect of social determinants of health. You can link clinical outcomes to location and income. The strategic question for evidence teams is no longer claims or EHR. It is now, what is our strategy for intelligent data integration? And this future is not optional. Federal mandates like the CMS Patient Access Rule are forcing providers to share data via modern APIs. This integrated data is the fuel for the next generation of healthcare AI. Merged platforms are already being built to power predictive models. So, claims versus EHR was never the correct question. The power lies in understanding the strengths of both to build the right data set. For your next project, don't begin by asking for data. Start by defining your most pressing business or research question.